Assalamu alaikum everyone. Hope you're all doing fine. Today, inshallah, we're going to discuss a very important topic, a very interesting topic. Today, we're going to discuss the cerebral blood supply. By the end of this lecture, the student should be able to enumerate the arterial supply of the brain, explain the arterial systems involved in supplying blood for the brain, enumerate branches of carotid and vertebral arteries, explain circle of Willis and identify arterial supply of specific brain parts, enumerate veins of the brain, and understand the clinical applications relevant to the topic. When we talk about the cerebral blood flow, we have to mention few facts concerning the cerebral blood supply. The brain in particular, among all the body tissues, is very sensitive to oxygen deprivation or oxygen starvation. We lose consciousness if blood supply stops for only 10 seconds. If we interrupt the blood supply to the brain for just 10 seconds, we lose our consciousness. If the state continues, we might have an irreversible brain damage that starts at 4 minutes and completes at 10 minutes. So after 10 minutes of complete deprivation or partial deprivation of blood supply to the brain, we might have a complete brain damage. The brain consists of 2% of the total body weight, so if someone weighs like 100 kilograms, his brain might weigh at this point like 2 kilograms. It receives 20% of the cardiac output and 20% of the total oxygen of the body. That's 1/5 of the amount of the oxygen needed by the whole body and 1/5 of the cardiac output. The word stroke means a cerebrovascular accident. CVA stands for cerebrovascular accident. It's a medical condition in which poor blood flow to the brain causes cell death. And we will encounter the word stroke with the blood supply of the brain as we continue in our lecture. The brain is supplied by two arterial systems, a pair of internal carotid arteries, so this part of the blood supply would be called a carotid system, and another pair of vertebral arteries, so this part of this cerebral blood supply would be called a vertebral arterial system. So we have two arterial sets that supply the brain with the blood supply. These arteries arise in the neck and ascends to the cranium inside the cranial cavity through the foramina present at the base of the skull. Within the cranial cavity, the terminal branches of these arteries form an anastomotic circle called the circle of Willis. From this circle, branches arise which supply most of the cerebrum. So, in general, we're having two arterial systems supplying the surfaces of the brain. These arterial systems are the carotid system and the vertebral system. They arise both in the neck, enter the base of the skull through the foramina to enter through these foramina towards the cranial cavity. These arteries eventually anastomose with each other, forming a circle that's called circle of Willis. This circle of Willis gives off branches. Some of these branches we will call later to be cortical branches, supplying the outer surface of the brain. And other branches from this circle of Willis will supply the deep structures of the brain, so we will call it central branches. All the branches are coming from the circle of Willis and the arteries contributing into it. This is a diagrammatic representation for our brain occupying the cranial cavity. These are the arteries contributing to the blood supply of the brain. As you see, we've got two arterial systems, a carotid system. We've got a common carotid artery ascends to the neck till the upper part of the thyroid cartilage, giving off an external carotid supplying the face and the neck, and an internal carotid entering into the cranial cavity. So the first system would be the carotid system supplying part of the brain, and the other system would be the vertebral artery or the vertebral arterial system. This vertebral arterial system enters the cranial cavity from the posterior aspect, and both arteries anastomose with each other. As you see, this is the junction between the arteries supplying the brain. This is the circle of Willis. And from this circle, we've got branches supplying the outer surface of the brain. So these are called the cortical branches, while other branches go deep inside the material of the brain beyond the surface. So these arteries are called central branches of the circle of Willis. The carotid system supplies like 80% of the surfaces of the brain, with the deep structures buried beneath these surfaces. And the vertebro-basilar system, or the vertebral arterial system, supplies like 20% of the brain tissue. This is another diagram. As you see, this is the side of the neck. We have dissected the superficial content to see what's deep beyond this superficial content. This is the common carotid. This is the bifurcation. This is an external carotid supplying the face and the neck. This is the internal carotid, the artery of concern. As you see, it enters from the base of the skull towards the cranial cavity. The other side, or the other end of the brain, is supplied by the other arterial set. This is formed by the vertebral arteries. They are two, this is a pair of arteries. So we've got a right and left one. These vertebral arteries enter also through the base of the skull to enter the cranial cavity to supply part of the brain, which we assume to be like 20% of the brain tissue and the underlying structure from the previous slide. For the internal carotid artery, it arises, as we have seen from the previous slide, from the common carotid artery in the neck. It arises at the upper border of the thyroid cartilage. And from this area, it enters the head at the base of the skull via the carotid canal. If you look at the base of the skull, the norma basalis externa, you'll see a carotid canal. This is the entrance of the internal carotid artery. And this internal carotid artery terminates by bifurcating or dividing into two branches, an anterior cerebral artery and the middle cerebral artery. So the common carotid artery enters from the neck through the base of the skull from the carotid canal, and eventually divides into two arteries, an anterior and a middle cerebral one. The extracranial segment of the internal carotid artery is from the origin of the internal carotid artery till the base of the skull. From the upper border of the thyroid cartilage, the area or the place where the common carotid artery bifurcates into an external and an internal carotid artery, the segment of the internal carotid artery from this point till the base of the skull, this is called a cervical part. Whereas the intracranial segment of the internal carotid artery is furtherly divided into three parts according to where this artery is passing through. So part of the artery is passing through the petrous part of temporal bone, so it's called a petrous part. Another part of the artery is passing through the cavernous sinus, so it's called a cavernous part. And the end of the artery, the last part of the artery, would be inside the cranial cavity, not passing into other structures, so it would be called a cerebral portion or cerebral part of the internal carotid. So we have got four parts: a cervical, a petrous, a cavernous, and a cerebral part. If we look back again to the same picture we've seen earlier, this is the first part of the internal carotid. This is the cervical part, from the point of bifurcation at the upper part of the thyroid cartilage till the base of the skull. Another part of the internal carotid would be passing through the petrous part of temporal bone, so this part is called a petrous part. A third portion would be inside the cavernous sinus, so this would be called a cavernous part. And the fourth part of the internal carotid would be inside the cranial cavity, so this is a cranial part. So these are the four parts of the internal carotid artery. This is a cadaveric picture. We're seeing now a superficial dissection of the neck. We are seeing the common carotid. This is the external carotid, and this is the cervical portion of the internal carotid artery. We said that the cervical portion starts from the bifurcation of the common carotid at the upper border of the thyroid cartilage till the base of the skull. So we are seeing now the first portion of the internal carotid, the cervical one. To summarize, as we said, we've got a cervical portion of the internal carotid, a petrous part of the internal carotid, a cavernous part of the internal carotid. This part would be inside the cavernous sinus, a twist in the path of the internal carotid artery at the anterior end of the cavernous sinus, twisting back. This is called a carotid siphon. This is a radiological finding. This is not an actual part of the artery. This is a radiological finding that you might see if you are looking at the arteries of the cranial cavity, and the end or the last part of the internal carotid would be the cranial part or the cerebral part inside the cranial cavity. So we are having a cervical, a petrous, a cavernous, and a cerebral part, and between the cavernous and the cerebral part we've got a twist in the path of the internal carotid. This is called the carotid siphon. This is an arteriogram. We are injecting the arteries of a patient with a dye, so it's more radio opaque, so we can see it with not an X-ray, with an MRI. As you see, this is a carotid artery, the common carotid. This is the bifurcation, the external carotid supplying the face and the neck. This is the internal carotid. This is the cervical portion of the internal carotid. This is the petrous part of the internal carotid. This would be the cavernous part of the internal carotid, and this is the siphon, and this siphon part would go to the cerebral portion of the internal carotid. So these are the parts of the internal carotid that we have just identified in the previous picture. This internal carotid artery gives off branches. The first branch that we see from this internal carotid inside the cranial cavity would be meningeal branches. These meningeal branches are responsible for supplying the meninges, the dura, arachnoid, and pia mater of the nearby structures. The second large branch coming off the internal carotid would be the ophthalmic artery. This artery enters the orbit through the optic canal with the optic nerve, supplies the structures of the orbit, frontal, ethmoidal air sinuses, frontal part of the scalp, and dorsum of the nose. The frontal part of the scalp through the supraorbital and supratrochlear arteries, if you remember them from the scalp lecture. So this ophthalmic artery, it's a huge artery, enters through the optic canal to the optic or the orbital cavity, supplying the forehead, part of the scalp, dorsum of the nose, alongside with the frontal and the ethmoidal air sinuses inside or between the two orbits and the bones of the cranial cavity. The third branch coming off this internal carotid would be a posterior communicating artery. Posterior, so it's going to the back, communicating, then this word is being listed here, meaning that this artery would link to another one. Okay, so this is called a posterior communicating artery. It's part of the circle of Wheelis when we will mention it later, inshallah. The fourth branch coming off the internal carotid would be the anterior choroidal artery. The word choroidal means the choroid plexus, that this artery would eventually form what we call a choroid plexus, and these choroid plexus will eventually give off the CSF, the cerebrospinal fluid. The fluid inside the cranial cavity is coming as a filtrate from these choroidal arteries. So this anterior choroidal artery supplies the optic tract, the choroid plexus of the lateral ventricles. These lateral ventricles would be the origin of the CSF, the hippocampus, and some deep structures of the hemisphere, including internal capsule and part of the basal ganglia, which is called the globus pallidus. The end of the internal carotid artery would be the final branches coming off it, terminal branches coming from the internal carotid, the anterocerebral and the middle cerebral artery. Both are the terminal divisions of the internal carotid. So we have got meningeal branches, ophthalmic branches, posterior communicating, anterior choroidal, and the anterocerebral with the middle cerebral arteries. This picture is for the base of the brain. This is the area called the interpeduncular fossa. This is the optic chiasma. This is the optic nerves, optic tract, and the crus cerebri. And as you see, this is what we call the circle of Wheelis that we will be talking about later in this lecture. The artery of concern that we are talking about, this is the internal carotid. This stump is for the internal carotid. This internal carotid will eventually divide into two branches, the anterocerebral and the middle cerebral. This is the anterocerebral artery and this is the middle cerebral artery. The branches, it gives off gives off the meningeal branches, gives off the ophthalmic artery. It goes deep with the optic nerve towards the optic canal and the orbit. It gives off the posterior communicating, and we mentioned that the word communicating means that it would eventually communicate with something else, and as you see, it communicates with the vertebrobasilar system at the back of the cranial cavity. And the last branches, as we mentioned earlier, would be the anterior cerebral and the middle cerebral arteries. So, as we said earlier, the internal carotid artery gives off two terminal divisions, which are called the anterior cerebral and the middle cerebral. Both are responsible for what we call the anterior circulation, supplying the full brain. The anterior two-thirds of the brain, this is called the forebrain. So these arteries are responsible for an anterior circulation supplying this part of the brain. And we said that the carotid system earlier supplies 80% of the brain tissue. Each of these arteries gives rise to a bunch of branches. Some of these branches are responsible for supplying the outer surface of the brain, the cortex of the brain. So these are cortical branches, where other branches penetrate the basal surface of the brain, deeper structures, supplying deeper structure, mainly the basal ganglia, the thalamus, and the internal capsule, and we call these branches the central branches. So they penetrate inside the brain tissue to supply deeper structures, whereas for the cortical branches, it runs at the surface of the brain, supplying the outermost part of the cerebral tissue. Particularly prominent, an artery or a group of arteries called lenticular-striate arteries that branch from the middle cerebral artery supplying the basal ganglia and the thalamus. These have particular importance because with hypertension, with increased blood pressure, they might cause an expansion in the walls of the arteries, causing what we call an arterial aneurysm. And this aneurysm in some people might rupture, causing a stroke. This is again a diagrammatic representation for the internal carotid. This is the cervical part, this is the petrous part, this is the cavernous part, and this is the cerebral part. And here in this slide, we can see part of the terminal branches coming from the internal carotid. This is the ophthalmic artery entering into the orbit. We said that it supplies the orbit, supplies the frontal and the ethmoidal sinuses, supplies the forehead and part of the scalp through the supraorbital and supratrochlear arteries. The two other terminal divisions of the internal carotid would be the anterior cerebral artery and the middle cerebral artery. Along with the posterior communicating, we said this branch would communicate with the posterior arterial system, the vertebrobasilar system. This is a coronal section being taken at the part of the brain to show the lenticular-striate arteries. These are central branches. As you see, an artery, a major artery, is going through the sulcus, as you see, between parts of the brain, and it gives off these central branches penetrating deep inside the brain tissue. These lenticular-striate arteries sometimes develop an expanded part, a thin part of its wall, liable to rupture. This is called aneurysms, and with sustained high pressure or with increased sudden increase in blood pressure might cause its rupture, causing a stroke. As we mentioned earlier, the brain tissue is supplied by two arterial systems, a cerebral, a carotid arterial system, and the vertebral arterial system. We said that the carotid arterial system is responsible for like 80% of the blood supply and the blood demand for the brain tissue, whereas for the vertebral arterial system, it supplies like 20% of the brain tissue. The carotid arterial system supplies the 80% of the brain tissue through the anterior cerebral and middle cerebral arteries, while the vertebral arterial system supplies the rest of the brain, the rest of the 20% of the brain tissue, through the following branches. These vertebral arteries are originally coming from subclavian arteries. Subclavian arteries are major branches coming from the aorta and its major arteries coming out of it. The vertebral arteries comes from the first part of the subclavian arteries in particular. This is a branch of the first part subclavian arteries. The vertebral arteries are divided into four parts, like the carotid arterial system. The carotid arterial system had a cervical, a petrous, a cavernous, and a cerebral part, whereas for the vertebral arteries, it also has got four parts. The first part is a cervical part. This cervical part is from the origin of the artery, from the first part of subclavian till the foramen transversarium of C6 cervical vertebrae. You know from the anatomy of the cervical vertebrae that it has got a foramen inside the foramen transversarium. So this foramen is in the transverse process called foramen transversarium. So the origin of the artery, part of the artery from the origin at the subclavian artery towards this foramen transversarium of C6, this is the first part. This part of the subclavian artery runs in the neck. The second part of the vertebral artery also runs into the neck, but inside the foramen transversaria in the upper 6 cervical vertebrae. So it passes through the C6 cervical vertebrae till it reaches up till the atlas at the first cervical vertebra. The third part of the vertebral arteries passes in the suboccipital triangle, then enters the cranial cavity through the foramen magnum. This is one of the major foramina present at the lower part of the brain at the base of the skull, and the fourth part of the vertebral artery appears just inside the cranial cavity on the ventral side of the medulla oblongata. This is a side view. This is a lateral view for the neck and part of the chest cage. This is the right side of the patient we're looking at. So this would be the brachiocephalic. This is the common carotid, right common carotid, and this is the right subclavian. As you see from the first part of the subclavian, we'll see this vertebral artery. The vertebral artery has got a part inside the neck that is outside the foramen transversaria. This is what we mentioned as to be the first part. Second part of the vertebral artery appears inside the foramen transversaria from C6 till C1. So this is the second part of the vertebral artery. At the upper part of the atlas, at the posterior arch of the atlas in the suboccipital triangle, will appear the third part of the vertebral artery, whereas the fourth part of the vertebral artery enters through the foramen magnum to appear at the ventral surface of the medulla oblongata. So we've got the subclavian artery, the first part before the foramen transversaria of C6, second part inside the foramen transversaria from C6 till the C1, the atlas, the third part at the suboccipital triangle on the posterior arch of the atlas, then enters through the foramen magnum to appear as the fourth part on the ventral side of the medulla oblongata. Another diagram showing both arterial systems supplying the brain. As you see, this is the carotid arterial system. This is the internal carotid artery with the parts of it. And this is the other part, the other arterial system supplying the brain. This is the vertebral arterial system. This is the first part, this is the second part, this is the third part, and this is the fourth part. These vertebral arteries ends inside the cranial cavity. As we have seen that the third part at the suboccipital triangle enters the foramen magnum to appear inside the cranial cavity. So the vertebral arteries end inside the cranial cavity by joining each other and uniting to form a larger artery that is called the basilar artery, and this appears at the base of the medulla oblongata. The basilar artery supplies or gives off the main blood supply to the brainstem as it runs in the ventral surface of the brainstem with all its content, with the medulla, the pons, and the midbrain. Connects to the circle of Willis to potentially supply the rest of the brain if there is a compromise to one of the carotids. So these vertebral arteries are actually very important. They supply one of the very important structures of the nervous system inside the cranial cavity, the brainstem with all its parts, along with what's left from the cortical tissue or the brain tissue that is not supplied by the carotid system. The branches coming off this vertebral artery would be like follows. We've got meningeal arteries. They are supplying the meninges covering the brain like the carotid arterial system. We have a posterior inferior cerebellar artery. This supplies the undersurface of the cerebellum at the back of it. Then we have an anterior spinal artery, and we have two posterior spinal arteries. We have got medullary branches to supply the medulla oblongata that this vertebral artery runs upon. So the vertebral basilar arterial system is actually two arteries having the same destination. The vertebral arteries forms the proximal part of the system, whereas for the basilar artery it forms the distal part. For the proximal part formed of the vertebral arteries, it gives off the meningeal branches like any other artery entering the cranial cavity. A posterior inferior cerebellar supplying part of the inferior surface of the cerebellum, especially the posterior aspect. An anterior spinal artery, two posterior spinal arteries plus medullary branches. As you see, this is the vertebral arteries. These are coming from the foramen magnum. This is the brainstem ending, and this is the spinal cord starting. As you see, each vertebral artery gives off one anterior spinal artery. They are actually two arteries coming from both vertebral arteries, but they unite to form one anterior spinal artery. We've got two posterior spinal arteries. They remain separated. As you see, this is posterior spinal artery. They are both arteries to both sides of the spinal cord. We've got medullary branches from these vertebral arteries supplying the medulla oblongata that runs just beneath the vertebral arteries, along with the posterior inferior cerebellar. As you see, the posterior inferior cerebellar artery is an artery supplying the back of the cerebellum at the undersurface of it, with the meningeal branches supplying the meninges at the back of the cranial cavity. Another view for these vertebral arteries, as you see, they enter as two arteries. Both unite at the upper border of the medulla as it joins with the pons. This is the basilar artery. These are the branches coming off the vertebral. As we said, we have a meningeal, we have a posterior inferior cerebellar, we have an anterior spinal and both posterior spinal arteries. The basilar artery is a continuation of the vertebral arteries. This is the distal part of the vertebro-basilar arterial system. We mentioned the vertebral arteries to be two separate arteries that ended at the upper part of the medulla and lower part of the pons by uniting into this basilar artery. So the basilar artery is formed by the union of the vertebral arteries at the lower part of the pons and completes its path just in front of the pons in a groove present in the midline. This is called the basilar groove, and this basilar artery ends by dividing into two terminal divisions that are called the posterior cerebral arteries. We heard the word cerebral arteries at this point like 3 times. We heard them with the carotid arterial system as terminal branches of the internal carotid, the anterior cerebral and the middle cerebral, and now we are hearing the word cerebral once more at the end of the basilar arteries to give off the right and left posterior cerebral arteries. This picture is particularly unique. As you see, these two vertebral arteries, this is what we call the posterior inferior cerebellar artery. It gives off the inferior surface and the posterior aspect of the inferior surface. As you see, the inferior surface is a big area. So it has an artery supplying the anterior aspect of it, but it's not coming from the vertebral arteries. It's coming from the basilar one. So I'm having a posterior inferior cerebellar artery, and eventually this one would be an anterior inferior cerebellar artery. So this picture is particularly important because it shows well the branch coming off the vertebral arteries that we mentioned as the posterior inferior cerebellar. The branches coming off this basilar artery would be like follows. The first one to appear would be the one supplying the anterior aspect of the inferior surface of the cerebellum. We mentioned the same artery at the previous slide. This would cover the rest of the inferior surface, so it's called anterior, inferior cerebellar. The other branch coming from the basilar would be labyrinthine, that enters inside the labyrinth of the inner ear. Pontine branches, this is obvious. The artery is running at the front of the bone, so definitely it would give pontine branches. Superior cerebellar artery, an artery giving the superior surface of the cerebellum its blood supply. So the cerebellum is supplied by 3 arteries, 2 to the inferior surface and 1 to the superior surface. And eventually this basilar artery gives off a posterior cerebral artery, 1 to each side of the midline. So if you want to test your knowledge, this is the origin of both arteries that we are talking about. This is the brachiocephalic to the right side, and this is the arch of the aorta. As you see, we've got 2 arteries. This is the carotid arterial system, and this is the vertebrobasilar arterial system. The carotid arterial system gives off an external carotid and an internal carotid. The internal carotid enters the cranial cavity. This is part of the internal carotid pathway. This is through the petrous part of temporal bone, then through the cavernous sinus. The other artery that you'll see, this is the vertebral artery. As you see, this is the vertebral artery inside the foramen transverse area. This is at the posterior arch of the atlas. And as you see, these are the vertebral arteries uniting, forming the basilar artery. So as you see, this is the arteries that we're mentioning, the right common carotid, right and left. Then these common carotids divide into internal carotid and external carotid. These are the internal ones. As you see, the internal carotid enters through the carotid canal towards the cranial cavity. And with the side view, you can see the vertebral arteries running through the foramen transverse area, then the posterior arch of the atlas towards the foramen magnum inside the cranial cavity, uniting with each other, forming the basilar artery. Now we are going to discuss in details the terminal branches supplying the brain tissue. We said that we've got 3 cerebral arteries, an anterior cerebral, middle cerebral, and posterior cerebral. The first 2 are coming from the carotid arterial system, and the last one is coming from the vertebrobasilar. We earlier described that each and every one of these arteries has got 2 divisions. One of them supplies the outer surface of the brain. These are called cortical branches, whereas other parts or other branches coming from these arteries enters the deep tissue of the brain, supplying hidden structure, mainly basal ganglia, thalamus, and the internal capsule. The anterior cerebral artery is the terminal branch of the internal carotid. Runs towards the longitudinal fissure where it communicates with the other anterior cerebral artery through an anterior communicating. This is the second time we hear the word communicating. The first time we heard the word communicating from a branch coming from the internal carotid. It was called posterior communicating artery, communicating between the anterior carotid system and the posterior vertebrobasilar system. The other word communicating here is listed with an anterior communicating artery. And this anterior communicating artery communicates both anterior cerebral arteries. These anterior cerebral arteries runs just over the corpus callosum backward till they reach the parieto-occipital sulcus, where they anastomose with the posterior cerebral artery. This is a diagrammatic representation for the cerebral hemispheres. We're looking from the front. This is the frontal loops, and this is the frontal poles of the frontal loops. These are the temporal poles, and I'm looking at the undersurface of the brain at this area. This is the interpeduncular fossa, and you can see here the circle of Wheeler's. This is the internal carotid. This is the branch that we are talking about now. This is the anterior cerebral. It runs towards the longitudinal fissure between the 2 cerebral hemispheres, runs at the upper surface of the corpus callosum till it reaches the parieto-occipital sulcus, where it anastomoses with the posterior cerebral artery. So this is the anterior cerebral artery, and this is the course of it. Another sagittal section being taken at the brain, giving off one cerebral hemisphere. This is the corpus callosum, connecting both cerebral hemispheres. This is the anterocerebral artery, and as you see, the anterocerebral artery comes from the circle of Willis, where the internal carotid artery goes to the longitudinal fissure between the two cerebral hemispheres, runs just above the corpus callosum towards the parieto-occipital sulcus, where it ends by anastomosing with the artery of the back that is called posterior cerebral artery. This is a cadaveric casting for the arterial blood supply to the brain. This is the anterior cerebral running at the callosal sulcus just above the corpus callosum towards the parieto-occipital one, supplying most of the inner surface of the brain. As you see, these are all branches coming from this anterior cerebral artery. This is an arteriogram. As you see, we have injected a dye inside the internal carotid, and this is the part of the petrous part, and this is the cavernous part. This is the siphon part of the internal carotid we mentioned earlier to be a radiological finding, and this is the cerebral part. As you see from the cerebral part, we've got a branch coming towards the anterior aspect of the brain. This is the anterior aspect, this is a frontal bone, and then twisting back just above the corpus callosum towards the parieto-occipital sulcus, supplying the medial surface of the brain. So this one would be the anterior cerebral artery. The anterior cerebral artery gives off branches supplying all the following. First, it supplies the medial surface, all except the occipital loop. We said that the course of the anterior cerebral artery ends at the parieto-occipital sulcus, just before it reaches the occipital loop. So it supplies all the medial surface of the brain just in front of the occipital loop, sparing this occipital loop for another artery. Then it supplies the lateral surface of the brain, only 1 inch strip superiorly, a part of the lateral surface. It's a 1 inch width part of strip. And it supplies also the inferior surface of the brain, in particular the medial part of the orbital surface. The anterior cerebral artery supplies the leg area of the paracentral, precentral, and postcentral gyri. So it supplies the motor part and the sensory part of the representing the legs, and this has a particular importance that we will know later, inshallah. This is again a diagrammatic representation. We are seeing now two brains, one with the features of the brain evident for us, and the other one is color-coded, as you see. This color-coded picture divides the brain into territories for these arterial systems. As you see, this is the anterior cerebral, this is the course of the anterior cerebral, just towards the anterior aspect, then twisting just above the corpus callosum towards the parieto-occipital sulcus, where it here anastomoses with the posterior cerebral artery. This anterior cerebral artery supplies all the medial surface, as you see, except for the occipital loop to the back, supplies parts of the orbital surface at the inferior surface of the brain, and 1 inch strip from the lateral surface of the brain. This is another picture showing all the surfaces of the brain with the territorial distribution of the anterior cerebral artery. This is the lateral surface. This is the 1 inch strip of the blood supply of the anterior cerebral supplying the lateral surface. This is the inferior surface of the brain, and this is also the territory for the anterior cerebral artery, supplying part of the medial part of the orbital surface of the inferior aspect of the brain. And this is the medial surface of the brain supplied by the anterior cerebral artery till it reaches for the parieto-occipital sulcus. These are all branches responsible for the blood supply to the outer surface of the brain, so they are called cortical branches. Each and every artery, called cerebral artery, as we mentioned earlier, has got a set of arteries supplying the outer surface, the cortical, and another set supplying the deep structures. The central branches of the anterior cerebral artery gives off what we call anteromedial set of central branches. These anteromedial set of arteries arises from the circle of Willis itself, as we will see later, inshallah. an anteromedial set of arteries pierces what we call the anterior perforated substance and gives off the anterior part, gives blood supply to the anterior part of caudate nucleus, lentiform nucleus. Those are parts of the basal ganglia, the internal capsule, in particular the genu and the lower half of the anterior limb. So the anterior cerebral artery gives off an anteromedial set of arteries supplying deeper structures of the brain. As you see, the deeper structure of the brain, it's also color-coded like the outer surface. So the reddish part representing the anterior cerebral gives branches supplying the caudate nucleus, part of the lentiform, along with the internal capsule, as you see, the genu, and part of the anterior limb. If the anterior cerebral artery is occluded by a thrombus, by an aneurysm, by whatever, this is what we call the anterior cerebral artery stroke. We said that the word stroke means an ischemia or obstruction of the arterial supply to part of the brain. And this blood supply, if it stops for more than 10 minutes, there is an irreversible brain damage that might happen. Occlusion of the anterior cerebral artery will lead to the following. It will lead to a contralateral hemiplegia. Hemiplegia means that I'm going to see a patient having paralysis to half of his body, a longitudinal half of his body, to the other side of the cerebral cortex. So if he's having a stroke to the right side, he would have a paralysis to the left side. If it's a stroke to the right side, then the paralysis to the left one. So it's a contralateral hemiplegia. This is paralysis or weakness mainly affecting the leg and the foot due to involvement of the upper part of the primary motor cortex. This one is present at the outer surface of the cerebral cortex at the 1 inch at the lateral surface along with the parts on the medial surface. Contralateral hemianesthesia means that this patient would suffer sensory loss, mainly also at the leg and foot area due to involvement of the upper part of the primary sensory area. We said that this anterior cerebral artery is responsible for the leg area in the precentral and postcentral gyri, so it's responsible for the motor and the sensory parts representing the leg and foot. Also, the patient may suffer from apathy and personality changes due to involvement of part of the frontal lobe, mainly the medial frontal gyrus present at the medial aspect of the frontal lobe. This is the picture of the anterior cerebral artery infarction. As you see, this is the cerebral cortex, and as you see, there is a change in the density of the brain tissue. And the change in this density occupies a medial aspect, a parasagittal plane of the cerebral hemispheres. This is the territory for the anterior cerebral artery, and this is where the anterior cerebral artery supplies the brain. The stroke occurs only if the blockage is after the branch point of the anterior communicating artery. Why? If the blockage came just proximal to this communicating artery, the communicating artery will give off an alternative pathway for the blood to supply both anterior cerebral arteries. Whereas if this blockage happens just following the anterior communicating, then it's an irreversible stroke because there is no alternative pathway to reach this area. So this is the picture for the anterior cerebral artery infarction or stroke. It occupies the medial parasagittal aspect of the cerebral hemisphere. The second terminal division of the internal carotid arterial system will be the middle cerebral artery. It's the terminal branch of the internal carotid and one of the largest branches coming from it. It runs in the lateral sulcus to reach the superolateral surface of the brain. As you see, this is the middle cerebral artery, and this is the lateral sulcus, the one separating the frontal and parietal from the temporal lobes. The artery called the middle cerebral artery runs into this lateral sulcus, supplying most of the lateral surface of the brain. This is another picture for the middle cerebral artery. The origin of the middle cerebral is as a terminal branch of the internal carotid, the circle of Wheeler, at the undersurface of the brain, and reaches to the lateral surface by passing between the frontal lobe and the temporal lobe inside the lateral sulcus, just above the insula, and gives off branches to supply most of the lateral surface, as you see. Another casting for the arteries of the outer surface of the brain. This is part of the temporal lobe being removed to show you the structures just beneath it. This is the middle cerebral artery running at the lateral sulcus, supplying the outer surface of the brain. This is the color-coded picture that we mentioned earlier. We mentioned it earlier for the anterior cerebral, and now we are mentioning the same color-coded picture for the distribution of the middle cerebral artery. As you see, it's coming between the frontal and the temporal lobe inside the lateral sulcus, supplying most of the outer surface of the brain except for the areas supplied with the anterior cerebral artery, the 1-inch strip at the upper surface of the cerebral hemisphere, and another part of the outer surface of the cerebral hemisphere supplied by the posterior cerebral artery. This is a more detailed picture for the cortical branches and the blood supply of the cortical branches of the cerebral arteries. The middle cerebral artery, as you see, supplies most of the outer surface except for 1-inch strip at the upper border and 1-inch strip at the lower border. Supplies the temporal pole. As you see, the pole of the temporal lobe is supplied solely by this middle cerebral artery, along with the lateral surface of the orbital surface at the inferior aspect of the brain. So the cortical branches of the middle cerebral artery supplies the entire lateral surface of the hemispheres except for a narrow strip supplied by the anterior cerebral artery, this one that we have seen at the periphery of the cerebral hemisphere. The occipital pole, because this is a sole territory for the posterior cerebral. We just saw it at the anterior cerebral artery distribution. It reaches for the occipital loop, but leaves it. It doesn't share in the blood supply of the occipital loop. The infralateral surface of the hemisphere, where it is supplied by the posterior cerebral artery. Thus, the artery supplies all the motor area except for the leg area. This leg area is supplied by the anterior cerebral that we just saw in the previous slides. Like the anterior cerebral artery, it gives off the anteromedial set of central branches. The middle cerebral artery gives off anterolateral set of central branches. They also pierce the anterior perforated substance. They supply the caudate and lentiform. Both parts of the basal ganglia. Supplies the internal capsule, the upper half of the anterior and posterior limbs, and gives off the lenticular striate or the Charcot artery. This group of arteries supplies the basal ganglia and the thalamus. These are central branches going deep inside the brain tissue to supply parts of the basal ganglia and thalamus, and these are particularly prone to developing aneurysms in people suffering from hypertension. These are the lenticular striate arteries, or what we call the Charcot arteries. This is the internal carotid. This is the anterior cerebral. As you see, it's going through the fissure, the fissure, longitudinal fissure between the two cerebral hemispheres. And if you see carefully, you'll see the connection between the two anterior cerebral arteries. This is the anterior communicating. This is the middle cerebral artery going between the frontal lobe, sorry, and the temporal lobe, going to the lateral surface of the brain through the lateral sulcus. Through its pathway through this lateral sulcus, it gives central branches. These are the central branches. These are the lenticular striate, the Charcot arteries, supplying the lentiform and the caudate, plus the anterior or the upper half of the anterior and posterior limbs of the internal capsule. These arteries, as we said, are particularly prone to developing aneurysms with hypertension, and these aneurysms might rupture at any time, causing a stroke at the brain tissue. These are the central branches of the middle cerebral artery. They are color-coded, as you see, supplying the lentiform, part of the basal ganglia, supplying the internal capsule. Another picture showing the same content. We are seeing here the internal carotid. These are the bifurcation. This is the anterior cerebral. This is the anterior communicating. This is the middle cerebral that we've just mentioned. These are the lenticular striate arteries, and this is the rest of the middle cerebral going through the lateral sulcus towards the outer surface of the brain. An occlusion in the middle cerebral artery would lead to a stroke, like the one we have just mentioned in the anterior cerebral artery. The occlusion of the middle cerebral artery would lead to a stroke involving the area, the cortical area supplied by it. So it would eventually lead to a contralateral hemiplegia and hemianesthesia because it's supplying both the sensory and the motor cortex of the outer surface of the brain. But these areas are sparing the leg areas, so it's mainly in the face and the arm. The anterior cerebral artery, you've got also a hemiplegia, but it's affecting the leg area mostly, sparing the other parts. This stroke in the middle cerebral artery affects most of the body except the leg area because it's supplied by the anterior cerebral one. Also, from the effects that might appear at the middle cerebral artery stroke, aphasia. If this artery was on the dominant hemisphere due to involvement of motor and sensory speech areas, so it might be a sensory aphasia or an expressive aphasia. Also, we can see a contralateral homonymous hemianopia. A right and left half of visions would be lost due to involvement of optic radiation. Optic radiation is supplied also by the middle cerebral artery as part of its deep branches. This is a picture for a radiological picture for the middle cerebral artery infarct. As you see, we have got a changed density at the outer surface of the brain. This is the outer surface of the cortex, and this is the deeper part. This is the central branches being involved in this stroke. So we have got a middle cerebral artery stroke as it's evident in these two pictures. The last one of the cerebral arteries is a posterior cerebral artery. It's the terminal branch of the vertebrobasilar arterial system. And it's responsible for blood supply of like 20% of the brain tissue. This posterior cerebral artery receives communicating branch and turns around the cerebral peduncle to reach for the tentorial surface of the brain. As you see, these are the vertebral arteries. This is the basilar. And the end of the basilar artery, there are two posterior cerebral arteries. Before these two posterior cerebral arteries turn to the back between the tentorial surface of the brain and the upper surface of the cerebellum, these arteries communicate and join the posterior communicating artery. This was one of the branches of the internal carotid artery. The posterior cerebral artery is responsible for the blood supply of the area called the occipital loop. We mentioned in the two previous arteries that they all reach for the occipital loop, but they do not supply it. This posterior cerebral artery is responsible for the supply of the occipital loop from all directions, from lateral, medial, and from the inferior surfaces of the brain. Also, this part of this posterior cerebral artery is responsible for supplying the inferior surface of the brain just beyond the tip of the temporal pole. The area in front of the temporal pole is divided between the anterior and middle cerebral, whereas for the area just beyond the tip of the temporal pole, it's supplied by this posterior cerebral artery. Again, this is the anterior cerebral running in the longitudinal fissure. This is the middle cerebral running between the frontal loop and the temporal loop, and this is the posterior running between the undersurface of the brain, the inferior surface of the occipital loop, and the upper surface of the cerebellum. The cortical branches supply the occipital loop. Medial surface goes for the occipital loop. Lateral surface goes for the occipital loop, and a strip along the lower border of the hemisphere till the temporal pole. The inferior surface also is supplied by this posterior cerebral artery, the tentorial part except for the temporal pole. The choroidal branch coming from the posterior cerebral, it's like the choroidal branch we saw earlier coming from the internal carotid. The choroidal branch enters the inferior horn of the lateral ventricle, supplies the choroid plexus. It also supplies the choroid plexus of the third ventricle. So it shares into the choroid plexus of the lateral and third ventricles. This is the share of the posterior cerebral artery in formation of the cerebrospinal fluid. The central branches for the posterior cerebral artery are equivalent to the central branches coming from the anterior and the middle cerebral arteries. Equivalent means that they are two sets equivalent to the two sets coming from the other two arteries. So the one posterior cerebral gives off two central arterial branches set. It gives off a posteromedial set and a posterolateral one. We saw the anteromedial coming from the anterior cerebral and a posteromedial coming from the middle cerebral. We've got two, an anterolateral, sorry, coming from the middle cerebral. We've got two other sets, a posteromedial and posterolateral, both coming from the posterior cerebral. The posteromedial set pierces the posterior perforated substance, supplying the anterior and medial nuclei of the thalamus, hypothalamus through the thalamo-perforating arteries, whereas for the lateral set of the central branches of the posterior cerebral artery, it gives off lateral and gives off branches to the lateral and posterior parts of the thalamus, metathalamus, the medial geniculate and lateral geniculate body through thalamo-geniculate arteries. The sublentiform and retrolentiform part of the internal capsule are also supplied by this posterior lateral set. This is the territory for the posterior cerebral artery. This is the central branches supplying the thalamus with the anterior and medial groups, with the subthalamus and metathalamus with the medial and lateral geniculate bodies. This is the summary of the internal capsule, the blood supply to the internal capsule. As you see, the anterior limb of the internal capsule is supplied by the anterior cerebral artery. The genu is supplied by the anterior cerebral and middle cerebral branches, direct branches from the internal carotid. Posterior limb is supplied by the middle cerebral through the Charcot artery of the cerebral hemorrhage. We said that these arteries are more liable for formation of aneurysms. Sublentiform part is supplied by the posterior cerebral, the central branches of the posterior cerebral. The retrolentiform is also supplied by the central branches of the posterior cerebral. An obstruction at the blood flow in this posterior cerebral artery would lead to a stroke involving the occipital loop. The occipital loop is the area that harbors the visual fields and the visual cortical area. So an affection for the occipital cortex would lead to a contralateral hemianopia, means that the same side of the visual field, both eyes would be affected. And this affection would have what we call a macular sparing, because the central part of the visual field would be spared, whereas for the rest of the visual field at the same side would be lost. This is a radiological picture for the area of the posterior cerebral artery infarction. As you see, it's involving the occipital loop of the cerebral hemisphere, both sides, especially at the medial aspect. This is a wrapping up for the blood supply of the cerebral cortex. This is the anterior cerebral, supplying most of the medial surface and the strip of the lateral surface. The middle cerebral artery supplies most of the lateral surface with the temporal pole, and the posterior cerebral artery supplying what's left of the lateral surface along with the occipital loop. The circle of Wheelis is an anastomotic channel between the previous mentioned arteries, the anterior, middle, and posterior cerebral arteries. It lies in the interpeduncular fossa at the base of the brain, formed by anastomosis between the two internal carotids and the two vertebral arteries. It gives off cortical and central branches, as we mentioned earlier, from the circle and supply the brain substance. It provides alternative route if one of the arteries is occluded. This is the benefit of presence of any anastomosis in the body. Anastomosis means if a blood supply is being interrupted from one of the arteries sharing or contributing in this anastomosis, Usually the anastomosis completes the blood supply from another source, and the end results, nothing happens for the target tissue. The circle of Willis is formed by the following structure: the right and left anterior cerebral arteries, the right and left internal carotid arteries. Between the anterior cerebral arteries, we've got the anterior communicating. This is part of the circle of Willis. We've got also right and left internal carotid arteries. We have the right and left posterior cerebral arteries, and we have the right and left posterior communicating arteries coming from the internal carotid, both sides to join the posterior cerebral artery. This is a diagrammatic representation for the circle of Willis and the contributing arteries. As you see, we have got here the internal carotid, one of the main contributors to this circle. This internal carotid gives off the anterior cerebral, and this is the middle cerebral. This internal carotid also gives off what we call a posterior communicating with the basilar arterial system at the back. So if you look at the contributing arteries, it would be like what follows. We've got the internal carotid. This is the main contributor. We have the anterior cerebral, both sides. We have an anterior communicating artery. This is part of the circle of Willis, communicating between both anterior cerebral. We have both posterior communicating arteries coming from the internal carotids, and these posterior communicating also join with the posterior cerebral. So the yellow part of the diagram, this is the highlighting part of the circle of Willis. This is the actual circle of Willis. So if a block happens to an area at this circle, usually the rest of the circle completes the blood supply to the area with the blockage. And usually this happens if the blockage is gradual or of a low magnitude. If a blockage happens suddenly, it might not be enough, or there might not be enough time for the blood to shift to this area and save the affected tissue. Another diagram showing the circle of Willis. These are the contributing arteries between the internal carotid and the vertebrobasilar venous system, and it also shows what we call the anteromedial set of central branches, anterolateral set, and the posteromedial and the posterolateral set of central branches coming from the anterior cerebral, middle cerebral, and posterior cerebral arteries. And these central branches are supplying the area just beneath the cortex of the brain, mainly the basal ganglia, the thalamus, and the internal capsule. Again, this is the undersurface of the brain. This is casting from the blood supply of the brain, showing the area for the circle of Willis. This is a cadaveric view for the circle of Willis. This is the basilar artery. These are the vertebral arteries, and this is the area where the circle of Willis will show. This is a more clear view. This is a nearer view. We're looking at the circle of Willis from inside the cranial cavity. This is the foramen magnum. This is the spinal cord. So this is the area where the circle of Willis should appear. It's formed by two vertebral arteries, as you see, forming the basilar, and this basilar gives off the posterior cerebral. This is the area where the internal carotid divides into the middle cerebral and the anterior cerebral, and this is the area of the anterior communicating. This is an arteriogram for the circle of Willis. We are seeing now these are the vertebral arteries. This is the basilar. These are the posterior cerebral. These are the internal carotids. This is the middle cerebral, anterior communicating, and both posterior communicating. So what's in between all these contributing arteries would be the circle of Willis. This circle of Willis is like the previous one. We have a vertebral artery, basilar, posterior cerebral, posterior communicating, internal carotid, middle cerebral, anterior communicating, but this one has got a large dilatation present at the circle of Willis. This is what we call an arterial aneurysm. This is an expanded part of the walls of the arteries of the circle of Willis. The walls of the artery are very thin. They are liable to rupture at any time and can cause severe fatal hemorrhage or a stroke. This is an aneurysm appearing at the circle of Willis and the contributing arteries. These are the percentages for appearance between the different parts of the circle of Willis, and the aneurysm appearing at the circle of Willis is called Berry's aneurysm. These are different modalities of arteriograms showing Berry's aneurysm at different parts of the circle of Willis. The circle of Willis has got many variants. These variants may cause the circle to be incomplete. As you see, we might not have an anterior communicating. We might have two anterior cerebrals coming from one destination. Okay, so these variations might happen and might appear in different people, and these variations have to be put in consideration when dealing with patients with strokes. The significance of this arterial anastomosis is like any arterial anastomosis in the body. It provides an alternative pathway in case of blockage of one of the contributing arteries. So if one part of the circle becomes blocked or narrowed, stenosed, or one of the arteries supplying the circle is blocked or narrowed, the blood flow from other vessels can often preserve the cerebral perfusion well enough to avoid symptoms of ischemia. This is provided that it does not happen suddenly. Okay, if a stroke, if an embolus, if narrowing appears suddenly in one of the contributing arteries, the vasodilatation in other arteries within the circle might not be fast enough to supply the amount of blood needed for the ischemic area. So if I'm having a narrowing in one of the contributing arteries that is happening gradually, then the anastomosis will take its time to vasodilate, to shift blood from one artery to another, and usually the area affected, the target tissue affected, will not suffer from ischemia. But if this happens rapidly, the vasodilatation of the contributing arteries might not be fast enough, so the patient might have symptoms of ischemia and stroke as if he's not having an anastomosis from the start. What's left of the lecture would be discussion of the venous drainage of the brain. The veins of the brain have thin walls. It's not like other veins of the body. They have no muscular tissue in its walls and they possess no valves. They are shifting blood from the cranial cavity towards the thoracic cavity, so it's going with the gravity, so it does not have any valves in the walls of it. Plus, they do not possess muscles in its walls. They emerge from the brain and lie in the subarachnoid space. This is the vascular area covering the brain. They pierce the arachnoid mater, meningeal layer of the dura, and drain into cranial venous sinuses. We have got two sets of veins of the brain. We've got external cerebral veins. They are superficial to the surface of the brain. And we've got internal cerebral veins, and they appear deep to the surface of the brain. The external cerebral veins are formed by the superior cerebral veins. These superior cerebral veins pass upward and over the lateral surface of the cerebral hemisphere and empty its blood into the superior sagittal sinus. The middle cerebral veins, they are divided into superficial and deep group. The superficial middle cerebral vein, it's a superficial one from the middle cerebral vein, so it's a superficial middle cerebral. They drain the lateral surface of the cerebral hemisphere, runs inferiorly in the lateral sulcus, empties in the cavernous sinus. It connects with the superior sagittal sinus by a superior anastomotic vein and with a transverse sinus with an inferior anastomotic vein. So at the lateral surface of the brain, we are expecting to see two veins coming from the external cerebral veins, the superficial ones. We have the superior cerebral vein. It passes upward to drain the superior sagittal sinus. We have a superficial middle cerebral passing through the lateral sulcus and having two anastomotic channels, one of them with the superior sagittal sinus and another one with the transverse sinus below. This is a diagram for the lateral surface of the brain. As you see, we've got a superior cerebral vein. These superior cerebral veins are a group of veins. Actually, it's not one vein. They are all draining into the superior sagittal sinus. We have got a superficial middle cerebral vein. This is part of the middle cerebral vein. This superficial middle cerebral vein runs in the lateral sulcus, having two anastomotic channels. One of them goes to the superior sagittal sinus, and the other one goes to the transverse sinus. The other set of veins connected with the middle cerebral vein is called the deep middle cerebral vein. It drains the insula and is joined by the anterocerebral striate veins to form the basal vein. This deep middle cerebral vein is not actually part of the external cerebral veins. It's part of the deep one because it starts the deep venous system of the brain. The basal vein unites from both sides to form what we call the great cerebral vein, and this great cerebral vein drains into the straight sinus. This is a diagram for the venous drainage of the cranial cavity. These are the venous sinuses. We have got here the deep middle cerebral vein draining the insula. It joins the anterocerebral vein with the striate veins here. They all unite with each other, forming the basal veins, and these basal veins unite to form great cerebral vein, and the great cerebral vein drains eventually into the straight sinus. The inferior cerebral veins drain into the nearby sinuses, especially the transverse sinus. The anterior cerebral vein drains medial surface of the cerebral surface, runs along the anterior cerebral artery, and this one joins with the deep middle cerebral and the striate, forming the basal veins. This is the anterior cerebral vein. This one joins with the deep middle cerebral and the striate veins. Both form what we call the basal vein, and this basal vein joins to form the great cerebral vein. The internal cerebral veins, or the deep ones, they are formed by the deep middle cerebral that we've just mentioned, the anterior cerebral, the striate, and they all form the basal one, which empties into the right sinus by the great cerebral vein. This is the deep middle cerebral vein. This is the anterior cerebral vein passing along with the anterior cerebral artery, joined with the striate vein coming from the thalamus. They all join together to form two basal veins at the sides of the brainstem. This is the midbrain. They join at the back of the midbrain to form the great cerebral vein, and this great cerebral vein drains into the straight sinus. Another diagram, the anterior cerebral, the striate veins, you see it's coming from the thalamus. With the deep middle cerebral, they form two basal veins. The basal veins form the great cerebral vein, and the great cerebral vein drains into the straight sinus. By the end of the lecture, I just hope that the content is clinically relevant and easy to digest. For any inquiries, please do not hesitate to contact at any time. Thank you.